enough. She's going to moderate the panel, too. Okay, no problem. So you all know me, and on our panel, we've got Nigel Witherspoon. You know him too, but I'll just say again that he's the Director of Operations for REUNlON Voices.
Yay!
Yay! Gabby Santos, Director of Health Programs for REUNlON Voices. Where's Mel? Okay. Mel Brown, peer educator for the Women Who Have Sex with Women program of REUNlON Voices. Dayanara Marte, also known as D, of Involved Rebirth. And Dr. Monique Gary. Pleasure to meet you, Dr. Monique. Dr. Gary. Clinical instructor in surgery at the University of New England College of Osteopathic Medicine and chief resident in general surgery at UMass Berkshire Medical Center in Pittsfield, Massachusetts. How do you get to do both?
Being paid in gas.
All right, so because we have limited time and we really want to make sure that we've got at least about 20 minutes to have a conversation with you and do, questions and answers, comments, whatever. We kind of structured this panel. We're asking the panelists each to answer a question. And I will ask the question, and I've got a timer that you will answer in 3 minutes. So there. And so the first, Nigel, for you, what is your experience of negotiating healthy and hot sex? What barriers do you face as a black gay man? You're on.
Testing. Okay, so we're working. I think the conversation really should, in response to that question, should focus on not so much my personal experience, because there is no negotiating when it comes to healthy sex as it relates to me. I've always been the, whether I'm top or bottom in the situation, whoever the insertive partner is has to wear a condom. That's just been bottom line. I don't believe in having sex if it's not going to be hot. By the time we reach the point that we're going to have sex, I pretty much know what's going to happen because we've talked about it in detail. And so we walk into the situation already knowing what's going to happen, so it is going to be hot. But I think that there are some black gay men who are not in such a position to negotiate whether or not a condom can be used during sexual intercourse. And I think that our discussion should focus on how do we empower those black gay men to take that power back in the bedroom. And I think that what is so beautiful about the organization I'm working for, REUNlON Voices, is that we are tackling those issues that lead to not being able to negotiate condom usage or safer sex when you're preparing yourself to have sex or you're preparing for a sexual encounter. And some of those issues deal with financial barriers. Some of those issues deal with education. As we work in this field, we assume sometimes that, what's been my experience, that some of us in this field assume that people know they should use a condom. They know how to use a condom. But I can remember a time we were in the office and one of the staff, Phil Burst, who's Director of Victim Services at REUNlON Voices, had to teach someone how to use a condom, had to teach them how to put it on. And this was someone who probably you would have assumed know how to use a condom. And so I think that we should just pay attention to why people are not able to negotiate safer sex and try to figure out ways to empower them to do that.
Gabby. One of the primary barriers to sexual health for lesbian and bisexual women and women who have sex with women, and what are yours?
Well, one huge one that kind of sets a precedence for everything that's going on an institutional level and in our communities is the lack of inclusion of WSW communities in research and how funding gets allocated. That really limits the amount of information that lesbians, bisexual, pansexual, and some trans men and some trans women have around the risk factors to HIV, STI, and Hep C. It also, due to limited culturally specific resources, doesn't give them access to rapid, confidential, culturally relevant testing services, connection to care, and follow-up that they need. These messages also get internalized by our communities and then saying, oh, well, you know, since I'm not at risk, then I don't have to schedule my annual visits to even get cervical exams or mammograms, right? And then the lack of connection to someone who can relate to them on all the areas, you know, Carmen, in your keynote, you talked about, like, it's not just, you know, the sex piece, but what is the makeup of all of that, the spirituality, the historical trauma, the lack of economic justice that their experiences as partners, as lovers, as parents, as community members who lack the support of their peers. Where are those safe spaces for them to be able to address those issues in a non-judgmental place, to then leads to more knowledge, like Awkward Society, you know, beautifully presented, knowledge is power, right? Once that knowledge is there, and once that trust is built with a culturally specific provider, then they're able to disclose and have these tough conversations about sex, like, you know, wow, this is why I choose to be a touch-me-not. Not necessarily because, you know, I don't want to experience pleasure, but because there is a lot of trauma that is keeping me from fully being liberated sexually and negotiating that safer sex with my partners. So at In Our Own Voices, we make those safe spaces to meet people where they're at, and not only them, their communities, because we know that WSW communities and LGBT people as a whole are an extension of their families, of their networks, and not just like one-to-one thing. It's like, what else is going on? We focus on trauma-informed care. So what that really means is shifting the language and the way we see. We don't ask, you know, what's wrong with you? We ask, what happened to you? And how can we support you? You know, so you can feel like you're a part of our community. How it affects me personally?
You have a minute here.
Okay, well, in 1 minute. Let me tell you that the dating scene can be tough, because I find myself, due to the sexism, the homophobia, the transphobia, and the lack of the support that femmes, who I'm particularly attracted to, get, that they may not come with the skills that they need to negotiate that hot, safer sex. So I do find myself taking the lead in that. Come on now, I want to just sit back sometimes and not always having to be the top on an intellectual level and physical, okay?
Well, very nice. Get going, girl. Thank you. How can women tap into their erotic zone?
Wow, my erotic zone. I've been working on that for about 39 years. Haven't quite gotten there, except that I know that when I go to the Dominican Republic, I put on some red lipstick and the curls come off, and I go straight into being a erotic LATlNA, and there's a major switch than this suit that I have on right now. And so depending on where I'm at is how I show up. But one of the reasons that's been a major barrier for me around what does erotic look like is because, like many of you, I am a victim of domestic violence and sexual assault and child sexual abuse. And so lately, what I've done, and I don't have a partner probably for this reason, is that I want to know who I'm in bed with. I want to know, you know, necessarily about your diseases or anything like that, but I want to know about the secrets you keep. I want to know if I'm in bed with a little girl who's looking for a mom. I want to know if I'm in bed with an adolescent who's never found themselves. I want to know if I'm with a young adult still in search. You know, I want to know your story, where you came from, where you at, because that's what's going to not necessarily tap into the amount of pleasure we're going to have, but who I'm going to wake up with. And what your expectations are going to be of me tomorrow when I don't show up the way you want me to show up. When I'm not the mother you want me to be. Or when I'm 10 years later in a real codependent, unhealthy relationship with someone I have fantabulous sex with, and that is about all. So for me, when I think about the erotic, I also think about, you know, is this person lying next to me and thinking that they don't deserve this? Thinking that they're not enough? That, you know, are they going to punish me tomorrow? Are they going to give me sex today and tomorrow when I don't show up? They're going to take it from me? Are they going to love me now because they're going to manipulate me into giving something and then tomorrow take the love away from me? And being a victim of sexual assault and going through a lot of different relationships where that got played out tremendously, I now disclose. I'm like, this is where I'm at. This is what's going on. I'm going to ask you, do you love me 10 times a day? You can take me to Jamaica, buy me jewelry, and I'm still going to be like, do you love me? Because that's the little girl in me who needs to know beyond what you show me. You need to tell me. So that's erotic passion.
All right.
Thank you, Dee, and thank you for transitioning so smoothly into the question that I was supposed to ask you. Instead of the one that I did. Media skills. So, Dr. Gary, I'm going to call what you asked, and direct my question to Mel. And the question is, as a transgender, non-conforming person, what's your experience of negotiating healthy and hot sex?
Well, first of all, my significant other, we try to maintain the safety word. Wasn't it Purple Rabbits this week? But on a serious note, on a serious note, the most sexiest thing to me is a woman that can acknowledge, safer sex. That is sexy, that's attractive. I've been with In Our Own Voices almost 2 years. And I've been a peer educator for almost 7. And I've learned now at 38 that it's okay for me to ask what it is that I want or what it is that I need out of my partner and to maintain a healthy sexual relationship. And it's sad to say, but I'm just learning that. I've been gay so long, but yet now I have realized that being within our own voices, that I do have a voice and I can ask for these things and expect these things for my partner. So, yes, that's healthy and hot for me.
Thank you. And finally, Dr. Is it Gary?
Gary, like Indiana.
Dr. Indiana. So if you could give us a few minutes of what you think the medical community needs to do in order to more effectively address the specific health and sexuality concerns of LGBT people of color.
Do that in one word, more. Not enough. I bring you guys greetings from the Berkshires. It's about an hour over the mountains, and the Berkshire Health System is probably a catchment area about 40 to 50,000 folks, and most of them don't look anything like us. And so being a representative and being a voice and being a person of color and a lesbian And a surgeon is a challenge. And so part of what I've been doing in the last 5 years is being a pain in the ass to the healthcare system to provide services. To reach out to the community in terms of promoting awareness, particularly for those diseases that affect from a surgical standpoint, so breast cancer, cervical cancer, for example, and providing those services. But the second piece of it, and you asked how did I get to be a clinical instructor at Unicom, is because the students and the trainees need to be trained in order to address this population. And there isn't anybody really to do that, and so part of my role has been making students really uncomfortable. Every year, we go a couple times a year and we bring transgender standardized patients. And we sit these students in a room and we teach them how to interview a patient. How do you ask someone? Because how many of us, I went to the emergency department in my hospital and I had abdominal pain and they handed me a pregnancy test. And I said, I've had sex with women. I don't need this. And the lady says, oh, well, I'll just say you decline. I'll just say you refuse. No, it's not clinically relevant. I don't need it. And teaching young doctors how to address and how to be sensitive, how to ask the questions. Who do you have sex with, and how do you love, and how do you have sex? And doing a prostate exam with someone who's transgender because you still have a prostate. Is a way to work from within the institutional setting, which hasn't been designed for us, but this is the vehicle that we have. So those are just some of the things that I've been working on. And I think the medical community really just needs to do more, but it also involves all of us to be vocal about it. To be those representatives and to be honest with your doctors about those issues. I know we've all probably had some maybe less than favorable experiences with healthcare providers, myself included. But to be real and to be forthcoming and to challenge them to treat you and treat you well is what I'm here to do.
Thank you. Sort of formal part of this panel before we go to you guys and questions and answers and comments. I'm going to say one word directed at each of you, and you're going to give me one word back that best describes a response. All right? Ready? Gabby, strap on.
Unisex.
Nigel, nipples.
Titillating.
D, anal.
Oh, cocaine.
There you go.
Dr. Gray, have a word? Sex toys.
Magic carpet.
And now, one word coming.
More.